Hello, my name's John Sutherland. I'm a husband to one, a dad to three, and for more than 25 years it was my extraordinary privilege to serve as an officer in the Metropolitan Police. It was my duty and my joy. But I think these are the most challenging times for policing in this country since the end of the Second World War. That's not some carefully crafted soundbite. It's just a simple statement of the truth. And it's for a whole combination of reasons. Number one, crime is rising. Certainly crime of the most serious kinds. But it's not just crime. Demand is rising too. Demand for the police to help, particularly as a consequence of the huge gaps that have appeared in the delivery of other critical frontline public services. Mental health is the one that most often gets mentioned, but youth services, adult social care, the list goes on and on. Crime is rising and demand is rising. But complexity is rising too. Policing has always had an element of complexity. That's the nature of the job. But it seems significantly more so now, particularly with the very rapid advance of technology as both an enabler of crime and an accelerator of harm. Crime is crossing not just geographic borders, but digital frontiers. And policing is infinitely more complex than it used to be. Crime is rising, demand is rising, complexity is rising, and risk is rising too. There are more police officers being more seriously assaulted, more frequently than at any point I can remember. And on occasions, some of them are paying the greatest price of all. These are the most challenging times for policing in this country since the end of the Second World War. Fewer officers and staff with fewer resources doing a job that's more difficult, more demanding and frequently more dangerous than it's ever been before. And of course, that can't fail to have consequences for the men and women who do the job. 6 years ago now, in April of 2013, I was working in South London at the time. I had a massive nervous breakdown. I was off work for more than 7 months, having barely missed a day in my career up to that point in time. And though I made it back to work eventually, I never made it back to full operational duties. Eventually I was medically retired from the job I loved, the only one I ever applied for, ever wanted to do. I was undone by a combination of exhaustion and anxiety and depression, a collection of events and symptoms and experiences that broke me into 1,000 tiny pieces. Now, I'm an awful lot better now than I was then, but I did myself some permanent damage along the way. And I think often, and I've spoken publicly often, about the things that might have caused me to break. Now, my policing career in an operational sense was entirely unremarkable. In the course of my career, I've worked with officers who've seen many more dead bodies than me, with officers who've been to many more fatal car crashes than me, murder scenes, cot deaths. But there's one thing that we share in common, all those of us who've done the job. It's what I would describe as the painful privilege of policing, which is to venture repeatedly into life's hurting places, at the scene of the crime or the car crash or whatever today's catastrophe happens to be. And if I've learned one thing over the course of the last 6 years during the course of my recovery, it's that it would be impossible, not improbable, not unlikely, that it would be impossible to do the job of a police officer for any length of time and to remain untouched by the things that you've seen and the things that you've done. I heard it said recently that most of us during the normal course of our lives will encounter a handful of traumatic events and incidents, 3, 4, 5. Frontline police officers and paramedics are likely to encounter as many as 600 to 800. That's an extraordinary number. Now, for as long as I was serving as an officer, for the first 20 years of my career until I got sick, I'd never really stopped to think about those things. I'd never really stopped to think about the cost and the consequence for me, emotionally, psychologically, physically. I just plunged into the adventure. I kept answering the calls. That's what police officers do. You ask most of them why they join, they'll say simply it's because they wanted to help people. They just wanted to make a difference. And the fact that those are well-worn phrases doesn't make them any less true. For more than 25 years, I worked with heroes. And I sometimes wonder as a society whether we've forgotten to be grateful to them for the things that they do on our behalf. If you listen to so much of what's said about policing in the public space, in the media and amongst politicians in particular, so often the focus is relentlessly on the negative. The police are racist. The police are corrupt. The police are incompetent. The police are resistant to reform and change. Well, do you know what? Sometimes they are. And sometimes they can be. But if that's the only story we ever tell, then we're missing most of the truth. Most of the people that I worked with, most of the time, are about as extraordinary as people can be. When you strip away all of the noise and the nonsense that's said and spoken about policing, the job is to save lives. It's to find the lost. It's to bind up the broken-hearted and the broken-boned. It's to comfort those who are grieving. It's to protect the vulnerable and to defend the weak. It's to step into harm's way in defence of complete strangers. Sometimes it's to pay the greatest price of all. I'm no blind apologist for policing. I'm not one of those who can see no wrong. Sometimes policing, both individually and collectively, gets it dreadfully wrong. And we should never shy away from holding policing up to the light, demanding more and better of it. But at the same time, we need to realise that most of the time, most of them are out there doing the things that most of us couldn't. Next time you see a police officer out there, go up to them and say thank you for what they do. It'll be worth it just to see the expression on their faces.